Oh my goodness, can your pain that you have in your life or your medical condition be treated without surgery with regenerative methods? What questions should you ask and what should you look for? We've got Dr. David Crane. He is a regenerative orthopedic specialist at Bluetail Medical Group with some answers. Doctor, thanks so much for coming in.
Thanks for having me.
Now, we've discussed this before, but I always start out with a little primer. Explain the process first to people who have never heard of it.
Really, regenerative medicine is the ability to harness the cells either that you're able to give us, which is the thing that we use the most often. Sometimes we'll add some umbilical cord or amnion-derived cells, which are processed in the US, just like every other medical device would be processed. And then we can use those cells to harness for an injury, whether it's in knee arthritis or lumbar disc disease or other tissue injuries that have been long-standing.
And what kind of results do you see in relation to the alternative, which would be surgery? Is it faster healing?
Not necessarily. The body has an ability to regenerate and heal tissues over a certain amount of time. Really, one of the things is that we try to avoid as much scar tissue as you might get with a traditional surgery. And there's certainly roles for surgery that are required, and the stuff that we're going after on the regenerative side classically are the things that have been either treatable by surgery in the past or poorly treated by surgery in the past, or that lead to chronic scar tissue formation or other things that are hard to get to and heal with surgery, for example, cartilage and injuries.
And as far as clinics go, I mean, they're all different. And how is yours different from other clinics? What should people look for? What kind of questions should they ask?
I think the biggest questions that we want to have patients ask are we using protocols that are safe and effective and have been long-standing and proven via data sets? We have multi-year data sets now for all the injury patterns that we treat. We do keep both pre and post data on functional outcomes as well as standardized scoring systems on surgical outcome scoring systems. Mm-hmm. I think using cells that have what is actually in the tissue that we say is in the tissue. For example, stem cells is sort of a generic term
now, yeah.
And there's a lot of products on the market that are growth factor products that don't have any stem cells in them. We've tested a lot of them independently. Many of those products are growth factors, which work well, but really stem cells, I think, if you're going to be buying a stem cell product, you better make sure that you're buying that product.
And finally, this field is always changing. What do we look for in the future as far as regulatory pathways?
The FDA, we work with the FDA as well in helping them figure out what protocols are appropriate. They are going to be coming down the next year or two and looking at product developers, product development, to make sure that they are on a good pathway for verifiable results as well as the products that have cells in them. So in the year 2020, you're going to see this market sort of shrink to be more controlled.
Yeah, Dr. Crane, thank you so much for coming in.
Thank
and
you.
That is Bluetail Medical Group. They're located in Chesterfield, Missouri on North Outer 40 Road. We're going to take a little